So I'm going to demonstrate here how the Shockwave works on her bottom of her foot here. It's a plantar fascia, outer part of the fascia here. We're going to go through and just show you and demonstrate this. Within this treatment, the first thing we do is we apply some ultrasound gel to the area to get conductivity. And what that does is it helps to drive that sound wave into the tissue a little bit more efficiently. And what I'll do is I'll apply it to this area. And as you can hear, you'll hear the shocks going in there in just a second of those sound waves and how they're doing it. So what we do is we move it according to the level of patient comfort here on the degree of depth and then also on the speed. So you'll be able to see right here the depth is set for the bottom of a foot, and they all areas of the body have settings to set the depth and how deep we want to drive that the impulses and the sound waves into the tissue. So we're going to start with that right here. All right, Jordan, if this is too uncomfortable, let me know. I want it to feel like a 6 or a 7 out of 10 on that pain scale, okay? How's that, okay? Okay. And as you can kind of hear it, that's the impulses. Each one of those shocks is a wave getting put into that. Okay, and I hit a spot, let me know, okay? And a lot of times when we find the congestion, it'll kind of tell us about it because it'll be uncomfortable or slightly painful. Okay? Okay? And so we'll just let that move. And then with this, I can also increase the speed as well, and that can help to get it to come around a little quicker and be less painful faster as well. Good. And so, okay, so with a common treatment, this will deliver anywhere from 1,000 to 2,500 impulses of these shock waves per treatment. Better? Good. Very good. And so that was a treatment right there. So with her right there, just for purposes alone, that was 1,000 shock waves delivered into this tissue. And again, the mechanism is to break free adhesions and actually facilitate a healing within that area, whether it be the whole plantar fascia or on the attachment spot, wherever it may be. In her case, the one that I found on the higher side was more along the lines and closer to the attachment spot of that plantar fascia. So that, in a nutshell, is kind of how the Shockwave works. If you have any questions, feel free to reach out.